So when somebody sleeps on this side, it tends to get pinched. This bone goes and rubs against this bone, the roof of the shoulder, and that causes something called impingement syndrome or a very painful condition. Such painful condition is the first condition where you start having a symptom of rotator cuff tear. Hello, I am Dr. Vikash Kapoor, Orthopedic Surgeon at Medical Hospital. Today let's discuss about something very common. All of us have pain while we sleep at night, especially on one side in the shoulder. And all of us go through an experience which is very painful. When I say all of us, well, it's most of us. And nowadays, a lot of patients are coming with an entity called rotator cuff tear. Now, what is this rotator cuff tear? Basically, rotator cuff is a confluence of four muscles which come and attach to the upper part of the shoulder, which is the shoulder bone, the ball of the shoulder which we lift. Now, these four muscles, subscapularis, supraspinatus, infraspinatus, and teres minor, all of them form a band which lifts the shoulder up. And once you lift the shoulder up, they start working after a certain angle. And as you take it down, they also hold the shoulder so that it goes down nicely and you don't feel the pain. When this muscle is torn, when this cuff is torn, which is the confluence of the tendon which is made of all the four muscles, then the protection of or the cushion between this lower bone and the upper roof of the shoulder is lost. So when somebody sleeps on this side, it tends to get pinched. This bone goes and rubs against this bone, the roof of the shoulder, and that causes something called impingement syndrome or a very painful condition. Such painful condition is the first condition where you start having a symptom of rotator cuff tear. It can be a partial tear, it can be a complete tear. Most of the partial tears of rotator cuff do not need any surgical treatment. But unfortunately, a lot of these tears which are complete tears and are very painful and are debilitating are better treated nowadays with arthroscopic rotator cuff repair. The earlier it is treated, the better, because it has been shown to cause less damage to the surface of the bone. It is shown to cause less damage to the strength of the muscle in the future, and also it is supposed to give you a much better functional result as you are able to lift your shoulders and do a lot of hectic activities later on. The more the tear becomes bigger, the more the tear becomes older, it may become less painful, but the function of the shoulder also goes down over a period of time. So there is a time between acute tear when it is very painful to chronic tear when it is less painful because of the tear itself. But in chronic tears, which is large tear, which is a very large tear, and the function of the shoulder is compromised, sometimes people start getting serious shoulder arthritis. And in a very late tear where people have severe shoulder arthritis, it can lead to an entity called a joint replacement in shoulder, a reverse shoulder replacement, which becomes a very painful condition and later on needs a bigger surgery. So I would suggest you look carefully at your rotator cuff. In case you have a small tear, get it treated at right time. And of course, there are lots of things which we need to discuss and talk about. But once you understand this entity called rotator cuff, it will be much easier to understand the treatment when it is offered to you. It will be much easier to understand how much do you need it. So the active individuals should be treated immediately for a complete cuff tear. The individuals who are in late age, who already have a compromised shoulder function, sometimes can get away with a tear which is not very painful with accessory muscle rehabilitation. But at the same time, the people who need to use their shoulders regularly and for athletic activities, even the smallest of tears need a repair. So it depends on which spectrum of time in life you lie and what type of tear you have and the type of treatment advocated by your surgeon. So the lesser, smaller tears in younger individuals are more amenable to treatment with surgery. The tears which are more forgiving in older age are less painful, can be conserved for a longer time. The perspectives differ, tears differ, and the treatment differs. Always go to the shoulder person who is getting treated, whom you are getting treated from, and you must make sure you follow the advice to the T. Rehab has a huge role. You must understand, before surgery you have to go for a rehab, after surgery you have to go for a rehab, and it takes time for the cuff tears to heal even after surgery. One more day, some more time, we will discuss the rehab for rotator cuff surgery. Goodbye.